So being that I was 30 years old when I first felt the lump in my left breast, I would not have thought about getting a mammogram or anything like that before. As it kept growing though, well, I did get it checked out by a doctor, and they did say it was fibrocystic breast and that it wasn't an issue, and they did an ultrasound and they found it to be benign. And obviously that was a relief, but at the same time, as time went on, I felt like, I've had a cyst before, and it wasn't like that, it wasn't the same experience. So I kept pushing, and I had to go back to the doctor several times to to make sure that it wasn't something serious, or to just get to the bottom of it. And that's when about a year later, after several visits, that they did note a high level of concern and want to do a biopsy at that point. So a mammogram wasn't done at that point, it was a biopsy, and that's when it came back that it was actually breast cancer.
I'm Anne, and I was first diagnosed when I was age 30. I found an area of discomfort in one of my breasts, and it was bothering me for some time before I got it checked out. Obviously, I was too young at the time to be eligible for regular mammograms or investigations, so I put off going to get it checked out. I put it down to being tired, I put it down to over-exercise, I put it down to clothes rubbing or wearing in a certain way. But eventually, I started to get flu-like symptoms. I was very fatigued, going to bed at 5 o'clock after work, and it just wasn't like me. So I eventually went to the doctors and I got it checked out. They did an ultrasound and a mammogram, and eventually a biopsy. And it turned out that it was breast cancer, which was quite a shock. I wasn't expecting it. I didn't at that time know of any family history. And I thought it was something that happened to older people. So it was, it certainly took some time to get used to, and to try and get the proper treatments and understanding of what the condition meant, and what it was going to mean for me for the rest of my life.
My son Mason was 3 when I was diagnosed, 3.5. And obviously that was just hard in and of itself, but I was thankful that I already had a child in that sense. When it came down to how serious it was and needing chemotherapy and all of those treatments, I wish I would have thought about fertility a bit more. The doctors didn't bring it to my attention, which looking back is surprising. I was advised not to get pregnant until 5 years after I completed treatment, and I was also advised that I couldn't get pregnant. I definitely did want to have another child, so I looked into the reasons and I asked the doctor, why shouldn't I get pregnant? Will the baby be at risk? No, the baby won't be at risk. Will this bring breast cancer back? That was a big one. It still is a big trigger for me. Babies and breasts kind of go together, whether it's breastfeeding. So I was nervous to get pregnant. The doctor explained that it wasn't so much that that pregnancy would increase your chance of getting a breast cancer reoccurrence, but it is statistically most common to get a breast cancer reoccurrence in the first 5 years after. So they say to wait that time, because say something did reoccur and you would need treatment, you wouldn't be able to receive that treatment while you're pregnant. So once I knew that it was just kind of like up to me of taking that chance kind of, and it wouldn't put the baby at risk in any way and wouldn't necessarily increase my chance of getting breast cancer again, then that's when I opened my mind to the possibility and kind of started exploring the idea of getting pregnant again.
One of my biggest concerns after I was diagnosed and I got over the immediate treatments was certainly whether I'd be able to have children in the future. Obviously I was very young, I was in the start of quite a new relationship. I knew that he wanted to have children, and so did I. And I was quite scared, and a lot of people said, maybe you won't be able to have children after treatments, after chemotherapy. And so at that point I decided to have IVF treatment prior to my chemotherapy. It all happened very, very fast. I didn't have a lot of time to think about it or make a real decision, I guess. I just wanted to defer the choice until later on. I was very fortunate. I was able to get pregnant naturally after that. Which I wasn't expecting at all. I think I'd been told so many times that it wouldn't happen. I'd been through the IVF, I'd been through so many treatments for the breast cancer, and I really wasn't expecting to have a natural pregnancy at all. So I was very, very pleased when I found out I was pregnant.
I feel happy that I'm pregnant. My husband and I, as I said, when the doctor said that I wasn't able to have a baby, he kind of looked at me and said, well, are you sure you want to try? Because he thought he was full. He was not convinced that he couldn't get me pregnant, like as if it was, up to him or something completely. And I said, well, I think that, if we try and it, works out, that I would be happy. And he, obviously he loves kids too, but he he wanted to make me happy, and he knew I wanted another child. And so he accommodated me and he was really happy. And like I said, I'm sure he feels pretty proud of himself. Somehow he's taking the credit for this. Women who would like to get pregnant after breast cancer, I would say don't give up. I would very much suggest and advise to probably be more, to think more ahead about it before going into treatment, just to ensure, because it's not everyone may get pregnant naturally afterwards. So I would suggest to talk about it with your spouse or your loved ones. Consider it, whether some people aren't married or not, or haven't had children yet. So that's like a future thought, or they may not be in a relationship, but that doesn't mean that you're not going to be in one and want to have a child one day. So these are the things that you really want to think about going into treatment, and to make sure that you have a plan and to consider it. So, and as far as anyone who, there's always the message of early detection, and to ensure that you stay on top of your breast health, to keep abreast of your breasts, and to do your your monthly checks, and to make sure, and if you don't feel something's right, it doesn't hurt to get the biopsy, it doesn't hurt to get the ultrasound. You just want to trust your instincts always.
My advice for anybody that's recently been diagnosed is that there's a great chance of survival, and not just survival, but an opportunity to thrive after a diagnosis. Yes, it's very, very difficult. Yes, the treatments are extremely hard. Yes, you lose a lot, but you also gain a lot. You find new strength, you find new opportunities, you make new friends along the journey. And hopefully you come out the other side and you see the opportunities to take on your life once again, to maybe take it in a different direction, to maybe appreciate things that you hadn't appreciated previously. For me, I'd taken my health for granted. That's something that I don't ever do anymore. Health is so important to me, family is so important to me. And I appreciate those things so much more, having come through a breast cancer diagnosis, treatment, and surviving. People can always reach out to the Breast Cancer Foundation directly, especially regarding fertility advice, and they can point you in the right direction after a diagnosis. Amongst other things, they have so many resources available, and they're always willing to listen and help. And if they don't know the answer, they'll find the answer and always offer it to you.